Good evening, everybody. I'm Ian Irving, Dr. Ian Irving. I'm ICON Group's medical director, and I'm also a practicing haematology. And joining me tonight, we have one of ICON's radiation oncologists, Dr. Vanessa Estall, who's an expert in skin cancer and going to be talking to us and answering your questions on skin cancer. Squamous cell carcinomas are sometimes referred to as SCCs.
Yes.
And basal cell carcinomas are referred to as BCCs. Have I got that around the right way?
Yes, you have, yeah.
Right. Okay. Well, and you mentioned some of the specialised treatment techniques, even before we go on to talk about treatment, for these skin cancers, SCCs, BCCs, and melanoma as well, what's the best way to prevent these skin cancers before we even get to treatment? Because we're always taught in medicine, just like we were taught by our grandparents, prevention is better than cure.
Yes. Well, I'd like to be able to give you a recipe to prevent 100% of these, but it's unlikely we can prevent 100%, but you can certainly reduce the risk of developing these during your lifetime and reduce the frequency of developing them, and hopefully mean that if you are to get it, that you'll get something that's early and easily to cure. So really the main way to reduce the risk is to try to minimize your sun exposure as much as you possibly can, which of course is difficult, but generally the rule of thumb is to avoid the sun when it's at its hottest and most dangerous, which tends to be that sun in the middle of the day. So from sort of 10 or 11 o'clock in the morning to say after 3 p.m, that sort of time in the middle of the day is when we know that the sun is at its strongest. So try to stay out of the sun during that time if you can.
Now, I'm just going to break with the program ever so slightly and just go over to a question that we'd had sent in earlier from Tony. And Tony, and it just follows on exactly from what you were saying there, Vanessa, about, of course, avoidance of sun exposure is very important, particularly in the middle of the day. Now, Tony writes in that he works in an office and really doesn't get much sun exposure, and he's worried about low levels of vitamin D. So what can you tell Tony and other viewers?
Yeah, and I've heard that question before, and people then get worried about balancing sun exposure to help with their vitamin D levels and then avoiding the sun and having their vitamin D levels drop. The thing that I would say is that the amount of sun exposure you need to actually boost your vitamin D through the sun on your skin, you don't really need a lot of sun. So most of the time you're talking about maybe 5 to 10 minutes a day in the sun. And so what we would tend to recommend, if you want to make sure that you're getting some sunshine in your vitamin, and that will help your vitamin D, you don't need any more than 5 or 10 minutes. And 5 or 10 minutes in early morning sun or early evening sun is probably the best way to do it.
On behalf of everyone watching, thank you for giving up your time and educating us on non-melanoma skin cancers.
Thank you, it was a pleasure.